What is physiotherapy? Physiotherapist is always present to help attain an individual's highest functional level by designing a specific exercise program and implementing physiotherapy interventions. These are based on the physiotherapist's clinical judgment, experience, diligence, compassion, and enthusiasm to dispense their expertise. The physiotherapist is concerned for the expectant mother and the child as it grows in the womb from the moment a child is conceived. The physiotherapist helps the mother understand the physical changes brought on by the pregnancy, before, during, and after the child's birth. This is the role of a physiotherapist in obstetrics. As the child grows, the physiotherapist can develop an exercise program to help the child attain typical developmental milestones. If the child has abnormal stages of growth, the physiotherapist monitors the child's development. This is the role of a pediatric physiotherapist, who has specialty training to treat abnormal conditions affecting a child's growth and movement. The physiotherapist specializing in sports medicine spends time in athletic courts, fields, and centers developing specificity training to help athletes attain their highest performance level and to prevent injury during sports. They also have to implement a physiotherapy intervention for a fast recovery to return to the sports arena quickly. This type of physiotherapist is in high demand in the athletic world, specifically during the Olympics and other international sports competitions. In the workforce, the occupational physiotherapist's role is to educate people about proper body mechanics and pacing techniques in the workplace. A work hardening program is beneficial to help workers return to their jobs equipped with knowledge and exercises on how to prevent injury at work. The physiotherapist can also design a personalized home exercise program for every patient or client. An occupational physiotherapist's focus is on preventing injury rather than curing it. In the middle-aged, where health problems like cardiac disease, lung disease, and other chest-related issues are most prevalent, a cardiorespiratory physiotherapist comes into the picture. Its job is to educate patients on how to care for their heart by reducing stress, performing proper exercises that don't overstress the heart, taking a proper diet, and practicing proper breathing techniques. The cardiac physiotherapist can develop a rehabilitation protocol to help a patient who has undergone cardiac surgery recuperate. Meanwhile, a neurology physiotherapist extends help to patients who have suffered a brain injury, like a stroke or spinal cord injury, those with Parkinson's disease, or those recovering from a motor vehicle accident. It's also the neurology physiotherapist's job to treat patients whose brain and nerve injury has left them with a residual motor movement disability, thus unable to initiate and do their daily activities. For pain management, a physiotherapist trained in acupuncture and manipulation can help with chronic pain brought about by musculoskeletal problems. Chronic pain clinics offer alternative physiotherapy techniques that are not limited to manual therapy and soft tissue release. In geriatrics, the physiotherapist can formulate a fall prevention program or treatment plan and an exercise regimen for a healthy lifestyle and wellness for seniors. The geriatrics physiotherapist looks into the safety of seniors by prescribing proper assistive devices and assessing the home and environment. If modifications are needed, the physiotherapist can recommend innovative and convenient equipment and appliances for the patient. In the LTCF and retirement homes, the geriatric physiotherapist assesses and implements the treatment plan and exercise program to restore the highest functional level or prevent the decline of function. The physiotherapist also determines the balance between safety and mobility for each fall prevention program. A physiotherapist's compassionate role in palliative care is also very important. A physiotherapist spends time with patients on the brink of death. They are involved with the multidisciplinary team that educates the patient and the family on realistic, acceptable, and comfortable measures that should be undertaken at the end of the patient's life.